Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Olabintan, CEO and founder of Livingspring Family Medical Center here in the awesome city of Mansfield, Texas. If you are watching live, hashtag live. If you're watching on replay, hashtag replay. And we're here doing another Facebook Live because here at Living Spring Family Medical Center, we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. Now, today we'll be doing a Facebook Live, and my guest is not here yet, but is going to join us shortly on the topic, Doc, I am planning to do bariatric surgery. How do I prep? Now, if you know someone who is planning to do this, how this would be useful for them, please, by all means, you could tag them in the post or in the comments, because we know that sharing is caring. All right. Now, some of you have wondered, why do we do this life? Now, I said we do believe in living, in helping our patients live long and well. But one of the other things, or one of the reasons where we do this, is to encourage dialogue, right? Conversations about healthcare, is also to find out answers to questions that we may have that we may not, I don't know, for whatever reason, we feel a little shy about asking during the doctor appointment. But today would be a good session. And I hope for those of you who are joining live, you're able to ask questions like, hi, Miss Linda, nice to see you. All right, our guest is here. Our guest is here. So I'm going to bring him up. Give me 1 second. All right, there we go. Hi, Dr. Andre. How are you?
I'm well. How are you?
Fine, thank you. Nice to have you here. How you doing?
I'm doing well, thank you.
All right, good. So I was just telling people why we did the Facebook Live. Now, before we go ahead, I would like you to please kindly introduce yourself. Who are you and what do you do, Doc?
Yes, my name is Dr. Andre Graham. I'm a general and bariatric surgeon. I've been in practice for 20 years, and I've been here in the Dallas-Fort Worth area for the past 10 years. I do pretty much everything, general surgery, and I also perform bariatric procedures and upper and lower endoscopy types, minimally invasive surgery.
Awesome. So you're also part of the doctors championing the cause to help our patients live long and well. Now, Doc, I was going to ask you, why do you do what you do? What got you interested in surgery and bariatric surgery? Why? Is there a story behind that?
Right. Well, surgery in general, ever since I was a small child, I wanted to be a physician. Was inspired to be a surgeon of just how fun it was in general, what I do. The aspect of bariatrics became attractive to me for a couple. One, it's a really requires a lot of technical skill to do. Surgeries are very interesting and unique, and I just find a lot of doing those procedures. In addition to that, I think it's a real health value who fit the morbid category. You see a real significant improvement in their overall health long term. It's not just cosmetic surgery for my patients. It's a commitment to a real health improvement, and it runs the gamut of medical problems that you can improve just by mere factor of losing weight and keeping weight off long term.
Okay. Now, do me a favor, Doc. You're kind of going in and out. I don't know if your speaker is on the tail end, so you might want to, how to say, don't put pressure on the speaker just in case.
Can you hear me?
I can hear you now. It's just kind of like chopped, like some words are kind of getting cut off.
Okay.
Okay, so now it's good. All right. So what is bariatric surgery, Doc, for those who are wondering? Because you said it's more than cosmetic surgery, and you alluded to the fact that it is actually life-saving surgery.
Yes.
So what is bariatric surgery for those who are watching?
There's a misconception. Bariatric surgery has been around for several decades, and the misconception is that it's cosmetic surgery, which it's not. It actually has real health benefits by virtue of the fact that it's a significant amount of weight. These surgeries basically have two main mechanisms of action. One is the size of the stomach, and also in some procedures, there are some malabsorptive properties with the procedure. So not only are you eating less, but you're absorbing less of it. And in addition to that, you do have hormonal effects that can affect the weight loss as well. But these surgeries basically are a tool to help a person who fits the category of being morbidly obese lose a significant amount of weight and keep the weight off. And that's really important because we know obesity is a very morbid condition. It carries a higher level of morbidity and mortality, meaning you having chronic medical problems and a higher death rate when you're morbidly obese. And so you're talking about the medical problems, diabetes, obstructive sleep apnea, hypercholesterolemia, hypertension. In women, you have breast, uterine, ovarian cancer, which those risks, and in men, prostate cancer, and also in both males and female, increasing colon. And in addition to that, you have the worsening of the quality of your life. Obviously, ability of reduced mobility, low back pain, joint pain, stress urinary incontinence, infertility. So these are all things that are again affect both the quantity of your life, and these surgeries help you lose a significant amount of weight. They affect all of those problems in a positive way, and it basically you have an improvement in the quality and quantity of your life.
Awesome. So you already alluded to the next question I was about to ask, but one of the things I wanted to emphasize is you did mention that this is not a cosmetic surgery. It helps reduce the risk of certain medical conditions. I've had patients who had bariatric surgery, diabetes went away, blood pressure went away, sleep apnea went away. So these are viable options for patients who need help to lose weight, to reduce risks down the line and even immediately. So I like what you do, Doc. Next question I was going to ask, and you alluded to it already in some of the comments you made. When should one consider bariatric surgery? I mean, it is surgery, and no one wants to say, "Oh, yay, surgery." But when would you say one should consider surgery?
So the National Institutes of Health have hard and fast guidelines with regards to that. So when we're talking about when we would consider bariatric surgery, we're looking at people technically, and you can look this up, it's body mass index of 40 or, and so in the category, your comorbid conditions are such that alone will qualify you for bariatric surgery in most scenarios. Anyone who's 35 with comorbid conditions such as diabetes, high blood pressure, we alluded to earlier, that is a qualifying factor. Some people need it for, as a pre-stage for orthopedic surgery, or because it significantly reduces the risk for that. A much lesser indication for that. But for people who are considering this, we're talking about a BMI of 40 or greater, corresponding to about 100 pounds more than your ideal body weight, or 75 greater than your ideal body weight, with other comorbid conditions positively affected by via bariatric surgery.
Okay. So thank you for the definition. So for those who didn't catch that, I'm sorry, you still got to break it up. But for the BMI of 40, without even any other medical conditions, that qualifies. And a BMI of 35 with comorbidities like diabetes, high blood pressure, then you could qualify. Of course, these are medical guidelines. You should see your doctor to come up with an individualized plan for yourself. But these are patients who automatically essentially qualify. Now, I have a patient who comes in and says, all right, doc, I have made a decision to have bariatric surgery. What would you say on average is the timeline between the decision to when the surgery is actually done? So we can have patients set realistic expectations for what it's going to be like as far as timeline.
It depends on the insurance. I would say usually anywhere from as short as 1 month to as long as about 6 months. And some insurance require physician monitored weight management for that period of time. Some of the things that before we do the procedure are things, one, being on a diet and demonstrating that you're able to stick to a diet. And that means counting your calories, staying below a certain calories per day, and also exercise regularly, because it's very important people understand in the global sense with regards to weight loss, the important aspect of losing, not just dieting, but also dieting and exercise. But we'll get into that more and get into that more. In addition to that, sleep study evaluation, psychological evaluations, dietary evaluations, and a nutrition consult. And then obviously in anyone who has a high risk, any pre-existing cardiac disease needs medical and or cardiac clearance before we do the procedure. As well, we scope the patient before the procedure because we want to make sure there's no anatomical contraindications to the surgery, meaning within the stomach or the esophagus preclude having the surgery done. And then we set you up. That's the process we go through, and depending on, again, how much you've already had done beforehand and what your insurance requires, that'll determine how long the process goes. So it can be as short as a month, as long as 6 months.
Okay. So anywhere from 1 to 6 months. And I love that you highlighted what the process entails during the time. It's not like you're waiting, like, okay, surgery date, I'm just going to sit here and wait. There are a lot of things that come into play. So let's talk more about that. So what are things you would say to the patient to prepare as one is anticipating the surgery? How can you prepare so you have best outcome, I guess, from the surgery? What would you say?
The first thing we do when we consult with a patient, we talk about their history of obesity. Is it something recent? Is it has been long term? What kind of foods do they tend to splurge on? Sweet eaters versus who doesn't eat a lot of sweets. That does affect the type of surgery that you consider, what their potential outcome would be. In addition to that, you kind of ascertain their level of activity and if there's any limitation to that activity, because it's very important to get on a diet and exercise both before and after the surgery process and lifelong. And then we talk about what type of surgery we've done. There's pretty much 3 main surgeries being done. By far the most common procedure being done is a gastrectomy. It's 2/3 of the procedure being done in the United States. And then the gastric bypass is second, which is 20 to 25% of the procedures. And then on a much lesser scale, the duodenal switch procedure, which is usually done for patients who are obese, but there has been that recently. And so we discuss what surgeries, the pros and cons of each one, what are their expected outcomes, and which one they would be most successful in. And then we go after that process. Then I usually see them monthly in the process of them all of those pre-testings and pre-evaluations before we do the procedure, and document things. There's an important point that I didn't touch on: smoking. I usually recommend, not usually, I always recommend people go on a smoking cessation program before they have the procedure done. That's
Will they go on what? Could you say that again? Go on a what?
A smoking cessation program.
Okay, smoking. Okay.
That's really important because there is a significant risk of complication with these procedures with someone who smokes. And there's various factors for that. But bottom line is I won't operate on someone who smokes until they have actually proven that they've quit smoking 4 months prior to the procedure. And that's a monitored smoking cessation program. Because if you do smoke and persist in smoking both during and post-operatively and through your life having these procedures, it's not a matter of if you have a complication, it's a matter of when.
Wow. Okay, that's big. A lot to digest here. So you go over how long they've had issues with their weight, obesity history. Go over their diet. What kind of foods do they tend to indulge in? Go over activity, and then you go over the types of surgery. You mentioned the 3 ones: the gastrectomy, the gastric bypass, and the duodenal switch. And smoking cessation is a big deal for this kind of surgery, particularly, I think for all surgeries essentially, but this one particularly because of the risk long term. All right, so Doc, for someone who's watching who's saying, well, I qualify based on weight and all of that, who would you say, but who would you say should avoid the surgery? Like who should stay clear?
Well,
I could maybe give maybe 3 or 4 examples of people who maybe should not consider the surgery.
well, for smokers, to people who have demonstrated non-compliance, and that's why we do psychological evaluations, not to check if someone has a mental disorder per se, but also just really to ascertain their level of commitment to the weight management program and following the directions, because there's a lot of information that goes into the diet, both and during and after having this procedure. Your diet completely changes, and it has to change for you.
Has to change.
And that's what's important. We put patients with, somewhat of a liquid diet before we do the procedure for 2 weeks. And that's the reason we do that, not to lose weight, but it does shown demonstrated. There's been demonstration the size of the liver or easier for us to do the procedure. And then post-operatively, we keep you on a liquid diet for a period of time. There's a phase about anywhere from 3 to 4 and it's specific, and that allows you to be able to ease into eating, because now you have a staple stomach. You don't want to stress that staple line, because staple line procedures can be pretty catastrophic, bad medically for the patient, for sure.
Okay, so there's a period before the surgery and the surgery for the liquid diet. Wow.
Correct.
So it's like training. Okay. And this is very important to note because of the risk of, regained. And I've told patients this who have had conversations with me about bariatric surgery. I say, I'm hopeful that you're committing to the lifestyle changes, because otherwise this surgery gives you maybe a year, 2, 3, after which you could just go back to where you were if you've not established those lifestyle habits as a way of life, so that way you're not back where you started. So go ahead.
So what I tell patients is, when you do these surgeries, I give them the analogy of viruses and computers. So if you're on a computer, you go to a website and you get viruses, right? And you computer clean the viruses, you reboot the computer. Do you go back to the websites that have?
No, you don't.
You have to fundamentally change what you do. So these patients with these surgeries, there's an expected amount of weight loss. So with a sleeve gastrectomy, the expected weight loss is about 60 to 70% of your excess body. If you're 100 pounds of your ideal body weight, everybody across the board, all studies have shown 60 to 70 pounds are lost of that. Wow. More or less, it just, that's what's been studied. In addition, gastric bypass, about 70 to 80, duodenal switch more than. Now, most of the weight loss is in the first 18 months to 2 years after the procedure. That's what we call the honeymoon phase. And you lose about 8 to 10 pounds a month during that period of time, as a rule of thumb. And then after that period of time, you haven't changed your lifestyle, committed to an exercise program, then you'll start to see the weight regain. And that's about 3 to 5 years. That rapid weight loss taper. You still have the effect of the surgery, meaning you still have the restricted process, you still can't eat, but that rapid weight loss period, honeymoon phase, tapers off about 2 years. So 3 to 5 years, you start seeing weight regain if you haven't changed your life.
Awesome. So for those who are watching, who are considering this, it's very important to also hone in on the process before and after the surgery. And I like that there's also a culture of almost like training or helping the patients through that before the actual surgery, so it's something that can continue a long term. So I usually prefer like the more than 1 month timeline between.
Definitely. And these are not anecdotal. These are the education and the process that we go through are things that are actually studied and found to be beneficial significantly beneficial in people who have these surgeries done. That's why.
Okay. Awesome. 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 This has been very, very helpful. I took some notes. So few tips. Last question, Doc. Any tips to minimize the risk of repeat need for surgery? You already alluded to it, but what are 3 things you would say to that patient is sitting right before you and say, okay, these are things you got to do so you make sure I don't have to see you again in a minute or so? What would you say?
Exercise regularly. Take your on a regular basis. And lastly, and probably most importantly, always keep a relationship and follow up with your physician that did your surgery.
All right, Doc, I'm going to need you to repeat that because I missed the first and the third one. You cut off. I'll need you to repeat that again.
Follow your diet.
Follow your diet.
Exercise regularly.
Exercise regularly.
Take your vitamins.
Take your vitamins.
And lastly, and most importantly, maintain a relationship with your physician. Follow up. I prefer to follow my patients for life. That's the important thing. You may not necessarily need to see them every month, every 3 months, but follow them regularly and make sure you're on track, because that's important.
Awesome. I concur. And it's not about, you'll go see the doctor, get a bill. It's about what can I do to maintain a good quality and quantity of life. So that being said, Doc, people are asking, all right, we got it. Where can we find you? If we want to have you come on and speak to us about these procedures, or if we want to come see you for a consultation and potentially have bariatric surgery with you, Doc, where can people find you?
All over the Dallas Metroplex. I'm primarily at THR Mansfield. You can also find me at in the Methodist Health System. My office number is, and I can give it to you, 875-8442. I do my bariatric procedures at White Rock Medical Center, and soon to be expanding that footprint as far as bariatric. Dallas Fort Worth is where you can find me. My group is the North Texas Specialists, and we are online and very easy to access.
Awesome. And what I'm going to do after the live, we'll have all that information posted in the comment section so people can connect with you. But I really appreciate you taking your time. I know you're busy. You're probably in the hospital right now. So thank you for taking the time to come talk to us.
Thank you so much. I really appreciate your time.
No worries. So thank you for those who are watching live or in replay. Please share. Caring is sharing, or sharing is caring, vice versa. And if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician in the Mansfield, Texas area, I am she. Have a good one. Thank you, Doc.
Thank you.